Hello, I'm Zahid Iqbal. Welcome to Shifa Clinic. This community clinic is a wonderful resource for people with diabetes. As a member of Shifa Clinic team, I want to extend a warm welcome and let you know that we're here to help you and give you the knowledge to manage your disease and your overall health.
What is type 2 diabetes? Diabetes is a long-term disorder of a high level of sugar or glucose in the blood. Blood sugar and blood glucose is the same thing. Insulin is a hormone made by the pancreas that helps sugar get from the blood into the tissues where it can be used for energy. Insulin unlocks the doors to the cells to let glucose in. In type 2 diabetes, the body does not make enough insulin or can't use it correctly, so sugar stays in the blood. The resulting high blood sugar levels can damage the heart, eyes, kidneys, and/or nerves. A person with a fasting blood glucose about 126 mg per deciliter on 2 occasions is considered to have high blood sugar and is diagnosed with diabetes. This means they are at risk for complications. What are signs of diabetes? Are you at risk? Type 2 diabetes is a disease that develops over time. There are many risk factors that increase the likelihood for developing type 2 diabetes. Older individuals who are not physically active have an increased risk for developing the disease. Overweight or obese individuals, especially those that carry weight around their midsection, are also at a higher risk. If a close family member, such as mother, father, sister, or brother, has type 2 diabetes, then one has a greater risk for developing the condition. High blood pressure or hypertension may also increase risk. If you are 40 or older and have 2 or more of the listed factors, you are at risk and should be tested for type 2 diabetes.
Even if you don't have any of these risk factors for diabetes, you should be aware of some signs of diabetes to look for in yourself or a loved one.
Increased hunger and thirst, increased urination, blurred vision, tiredness, and sores that do not heal could be signs of type 2 diabetes. If you or anyone you know experiences any of these symptoms, bring it to the attention of a healthcare provider. Early detection minimizes complications. Some cases of type 2 diabetes show no symptoms, and you may not notice any of the early warning signs. Therefore, if you know you are at increased risk for developing type 2 diabetes, it is very important you visit your healthcare provider for diabetes screening. This is essential to minimize the complications. Special issues for people of South Asian origin. Type 2 diabetes is the most prevalent form of diabetes that affects 1 out of 4 people of South Asian origin living in Western cities. If one of your parents has the disease, your risk drastically increases by 40%. Even though parents may develop diabetes after the birth of their children, the risk to produce less effective insulin is passed on to each child. Always remember that maintaining a healthy weight, watching what you eat, and exercising regularly may prevent diabetes. Complications of type 2 diabetes. In untreated or advanced diabetes, complication can result from high blood sugar levels. Damage may occur in the small blood vessels in the back of the eye, which may lead to blurred vision or even blindness. Kidney disease may result in kidney failure. Nerve damage in the extremities may result in inadequate healing of cuts and scrapes, and even unnecessary amputations. People with type 2 diabetes are more likely to develop heart disease. All of these complications can be minimized or avoided with tight blood sugar management. Shifa Clinic offers numerous screening to spot these problems at their early stages. If you are diabetic or may be at risk for developing type 2 diabetes, please take advantage of this great opportunity. I have type 2 diabetes. Now what can I do? Treatment for type 2 diabetes involves 2 parts of lifestyle changes and medication. The first component refers to active changes that you can make to reduce your chance of developing complications from type 2 diabetes. The second component includes medications that your doctor may prescribe to help manage this disease. Successful management of type 2 diabetes relies most heavily on lifestyle changes made by you. Lifestyle changes include monitoring your blood sugar, controlling your diet, exercising regularly, and managing your weight. Monitor your blood sugar to make sure it stays as close to normal as possible. This should be done a minimum of 4 times a week, preferably at least once while fasting, once 2 hours post-meal, and then 1 time randomly. There will always be an increase in blood sugar after eating, but it should return back down before the next meal. Things you will need to test your blood sugar are lancets, finger stick device, test strip, blood glucose meter, cotton ball for blotting spot where you draw blood, and a logbook. Self-monitoring is important. Wash and dry your hands. Turn the meter on. Place the strip in the meter. Check that the code on the meter matches the code on the bottle of the test strips. Change the code on the meter if these numbers do not match. Attach a lancet to the finger stick device and draw a blood sample. Bring the blood sample to the test strip. Ensure that the blood sample fills the yellow area on the test strip. Place a tissue or cotton ball over the place where the blood was drawn to stop the blood flow. Record blood sugar results in your logbook.
Results may take anywhere from 5 to 30 seconds. Always read the instructions manual that came with your meter because each meter is slightly different.